Hello, everyone, and welcome to another edition of Paging Dr. Ram. Today we are going to be talking a little bit about phobias involving noise and some of the weather situations we got going on with 4th of July coming around, all the loud noise stimulus, and how to best prepare your dogs for this and what to do if they're really overwhelmed by these sounds. So just as a reminder, you can go ahead and participate in this dialogue today by either commenting in the comments section below, or you can also go ahead and participate by using the hashtag #PagingDrRam on either Twitter or on Facebook. My name is Kyle Tate, and I'm a graduate student in the biology department under Dr. Jenny Willis over at Colorado State University. And today we're going to be answering your questions about this. So I'll be moderating. And I will go ahead and let Dr. Willis go ahead and give herself an introduction here.
Hi, I'm Dr. Jenny Willis, and as Kyle alluded to, I oversee a master's program in zoo, aquarium, and animal shelter management. I also am an applied animal behaviorist, and I work with cats and dogs on problems just like these. A little bit more about me: I teach a couple classes here at CSU in animal behavior to help people better understand companion animals and some of the issues that they may have. I also have a lot of animals of my own, as you might imagine. We have chickens and goats and several dogs and cats and lots of children, and we have a really good time. As summer's starting, I know not everyone does because some of the stimuli that are happening right now. So we'll get to talking about that some more in just a minute.
Awesome. Well, thank you so much. And so what we're going to have, the format for this morning is we're going to have Dr. Willis go ahead and give us a brief presentation about the topic. And then what we're going to do is open it up for questions at the end. So we've already got some questions from some of the viewers already. And then the rest of you are able to go ahead and continue to ask questions as we're going if anything pops into your mind. So with that, I will open it up to Dr. Willis to go ahead and get started.
Thanks, Kyle. So I wanted to give just a brief introduction to kind of better understanding what fear is and what specifically fear of noises might mean for your pet. So we're going to focus on understanding that fear today and how we can help our pets through that time, since even though they may not be destructive or be causing symptoms that might be affecting your life, it's definitely affecting their well-being. And they don't feel good when this is going on. So anything we can do to help them feel better is what we need to do for their own sake. So first, I just wanted to mention kind of some ways that fear can come out. Sorry. So first, I just wanted to mention some ways that fear can come out in our pets. And so we talked last time about aggression, which is certainly one endpoint for how a fear might manifest in your cat or your dog. A lot of what we're going to talk about today may have more to do with kind of the panic response to fear. So when they hit that threshold and they go over that threshold, they may be trying to flee, to escape. Sometimes for some of these phobic dogs, they may be trying to go through windows or escape their crates. So they're panicking essentially. So that's the flight part. And then a lot of times they can exhibit some more passive ways to demonstrate fear. So that might mean that they are trembling, drooling, shaking, pacing, or just very, very still. And that freeze sort of fear response. A fear can be normal behavior. However, it's typically when we talk about a fear that's a problem, it's an inappropriate level of fear. So it's having a large response to a very small stimulus. However, in the case of some of the things that we're going to talk about today, like big booming cracks of thunder and 4th of July noises, even sometimes we are startled by those noises too. It's just a matter of how we manage it. And so sometimes the fears can be rooted in something that might be reasonable, but they just have more of a response than is healthy or safe for them. So the brain has a response, and there's kind of two competing parts of the nervous system, if you will. When everything is well and there's no things in the environment that pet is afraid of, they have a low heart rate, their blood pressure is low, their breathing is slow and deep. They are hungry, they'll eat, they'll play. They have the ability to do digestion, which is really only something that they can do in a calm state. But most importantly, we would kind of, think of them as this is their smart, or their smart brain is in charge of them at this point. So their higher brain is making the decisions. So they remember what you've taught them. They can follow simple directions. They can, follow cues that you might have told them or taught them in the past. But then when things kind of go south a little bit and they hear or experience a stimulus that makes them scared, then another part of the nervous system engages. And so in that sort of beginning of that response, there are changes chemically going on in their body from that first point that they can detect something might predict something they're afraid of. So that could be several steps back from when the actual crack of thunder happens. And we'll kind of go through kind of understanding that. But it can be a predictive response. So the very soonest that they can predict from their environment that something will go wrong, their body responds by making adrenaline and then by making cortisol. And that response just doesn't go quickly away. And so they have a higher heart rate, they're breathing faster. As they get more scared, as more of those sort of chemicals in their blood kind of build up, they stop being able to do digestion, they stop being able to eat. That could be sort of a measurement or a gauge of how are they doing, how bad are they feeling right now. And most importantly, they're not reasonable, what we would consider our usual pet. And so their fear brain, their limbic system is really in charge of driving their actions at that point. And so they're definitely, responding, reacting to their environment, not responding to cues that you might be giving them. So we're going to specifically today focus on a fear of loud noises. That might mean thunder, that might mean gunshots, that could mean fireworks. It might just mean clanging pans. Since sometimes when they've had a loud noise experience that has kind of traumatized them, some other noises that may not be quite as loud they might have a more profound response to those in kind of subsequent times. So we can see kind of the generalization of loud noises from one to another. And there's a reason for that. In the brain, there are different kinds of cells that are responding to different kinds of auditory or input. And so if the ear hears a noise and it's a really low level noise, like, a fan or even someone tapping their pencil in the background, the brain can actually tune that out, so much so that the neurons actually stop firing in response to that noise. And so if you think about where you are right now, you could kind of, listen carefully for a second and probably hear some things that are happening in the background that you might not have even really been aware of. And that's low level, low intensity noises. And that phenomenon is called habituation, where the neurons actually stop responding to that stimulus that's clearly not relevant to anything going on in your life or your animal's life. However, very loud noises are a different kind of neuron that's processing that information. And every time that loud noise happens, they always respond. And so they never habituate. So it's not a matter of not hearing the sound. The animals that don't have problems with loud sounds do hear the sounds, but they're not considered relevant information to kind of provoke a fear response in that animal. So it has to do with what happens after that input goes to the brain. So with loud noises, and while this phenomenon is more observed in dogs, cats certainly react to noises as well, although they can be environmental noises that evoke very strong startle responses. So why are there some animals that have so much bandwidth to accept new stimuli that are potentially frightening, but yet they don't seem to lose control or go over that threshold into the sympathetic side? There are a lot of reasons why that might be true. So in my little graphic here, we have, one animal on the right that maybe only one or two things have to happen to before they are up and over their threshold, not able to eat, pacing, panting, crying, trying to escape. Whereas on the animal on the left, a dozen or more things could happen before they get to that same point. So why is that? I get that question a lot. And it has to do with many, many things. There's not just one thing we can point to. That while there are specific lines or there is some heredity towards reactivity, it's not one particular breed that's more effective than another. It tends to be an individual thing. When they're subjected to early stress or when their parent, the mother, is reacting strongly to stimuli in her environment, she may be helping those offspring learn that those are in fact relevant stimuli and those are scary things. Early weaning can cause stress and can kind of change that young animal's brain towards the future, even as an adult. They show more fear-based behaviors if they have had that happening. Lack of early handling or lack of early exposure to sounds prior to 14 weeks could influence their ability to tolerate and manage themselves in the presence of those sounds. Lack of socialization, so lack of early experience, again. Neurochemical imbalances, so sometimes being on medications for other reasons or other medical conditions can alter sort of the brain chemistry playing field that they had before. Hormonal issues can cause changes in their behavior as well. We'll talk a little bit more about that. Any issue that's causing either chronic or acute pain can certainly cause them to be more on edge and more less able to handle things. So that's something that's reasons why we encourage you to look towards your vet and make an appointment to kind of evaluate the state of your pet medically as well, so that we can proceed through helping them, from a behavioral standpoint with a clean kind of bill of health, so that we know we're just dealing with a behavioral issue. So that we can proceed through helping them. So there can be some traumatic experiences that maybe they've had happen. I've had situations where a pet may have been very close to a strike of thunder, and that may have sensitized them towards that sound since they had a legitimately frightening experience. And then being in a stressful environment in general can cause them to cope less well with any one particular thing. Medical causes of fear and anxiety. One of the biggest ones to not ignore is age. With age, and sometimes we see this seasonally with our pets, where last thunderstorm season, they were in a different place in their life, and now we've had another winter of aging and changes with their sensory perception. Sometimes there are changes in how they process that information, and that can cause them to be more nervous and respond differently to things they've been exposed to before. So that might point towards cognitive dysfunction. We might be seeing an organic brain issue like a brain tumor. Allergies can cause them to feel more on edge and startle more easily. So really it's important to visit with your vet and have kind of a full medical evaluation, especially if this is a new fear. The typical age of onset for for noise phobia tends to be midlife. Most of the time, young puppies may not show this, but as they age and become adults, they might start to show more profound reactions than they might have as a puppy. Sometimes very passive responses or avoidant responses aren't noticed as puppies, but then as adults, that can change to being more obvious and more difficult to miss. So we're going to kind of focus on thinking about this type of stimulus in their environment, what all that means, and what might be some of the provoking cues. We want to try and focus on helping them feel better, because that, from a behavioral standpoint, is in their best interest and their welfare. So we want to change fearful behavior into a different emotional response. So we need to really help them realize that their life isn't in danger, that they're okay, and that there are other coping strategies they can use to keep their stress low and make sure that they have, some adequate ways to relieve that stress, that don't leave them feeling feeling without an option, which is sometimes where that panic may lead them to try to escape from a situation. We want to ideally start well before that panic point to try to help them feel better about these things. We need to focus on changing that emotional response. So we're not doing something where we're trying to teach them behavior for reward. We're trying to help them feel better. And so we use a different kind of process called counter conditioning, where we pair that previously fearful stimulus with food. And so that starts to help them feel more positive and anticipating, hey, every time I hear a rumble of thunder, I get a piece of chicken. And that starts to change what their expectations are when they hear that sound. And the problem really that exists with this stimulus is that there's so much surrounding it, especially with storm phobia. If we just look at all the things that a dog or a cat can detect about storms, they are getting information way more than a distant rumble of thunder. We have the color of the light coming through the windows when it's overcast. We have the sound of rain hitting the windows. We have the appearance of cloudy windows with rain. Then we have things that we wholly can't control at all. So changes in barometric pressure that precede a storm, ozone, and static electricity, things that we may not be perceiving quite in the same way that they can and do. We have the sound of wind that often comes right before the rain. And so there's a whole set of cues that kind of begin. And while not every cloudy day yields a thunderstorm typically doesn't happen without some sort of cloud. And so you start to see this sort of predictive pattern that they start to get anxious when they see the cloud or they feel the pressure drop, that kind of thing. We certainly have had some acute hailstorms here in Fort Collins over the past few years, and I definitely see a surge of new clients whose pets are struggling with this, where their house got torn up with siding and roofing with hail, loud and totally different than other storms that pet may have been through. But now all of those same storm cues will now predict possibly that end point. And so the pet gets anxious and panicky prior to that hailstorm coming. So we'll talk about what we can do. It is something where we want to use food, but not ask them to do something for it. So we need to think about, again, making any of those cues we just discussed pair with food. And so we can help them start feeling better. They're showing us they're able to eat. They're showing us they're calm enough to eat. And if we can keep them eating, often we can keep them out of that over threshold zone. And so ideally, in a perfect world, graded intensity or gradual exposure to those stimuli would be best. But all of you, I can hear you chuckling out there now or crying out there now that no, it doesn't happen that way. We don't get to have, the graded intensity storm, and or maybe you're not even home when the storms happen. And so how can you practice this? How can you do this? The idea is that nothing bad should happen, but a crack of thunder with you not home might definitely be a bad thing happening. So that's what makes thunder phobia one of the more difficult and challenging, types of behavior problems to work with, is that we don't get to control the environment and we can't wholly prevent it, although I'll give you some ideas on how to do that. But don't lose hope. There are many things that we can do that don't, involve you being home for every storm forevermore. And other sounds can be much easier to work with. So for example, the sound of gunfire. You could start, with your dog inside your house with a recording of a gunshot on a phone or on a television that you hear, that you start pairing that with food. And you always want to have the food happen within a half a second of the gunshot sound or whatever sound we're talking about. So it should be sound, then food, just like that. Sound, then food. And it should be pauses between the times that you expose them. Ideally, you should have them be able to show you some sort of calm behavior in between those exposures if you have control over that stimulus, like the recording, for example, so that they can show you at least that they're calm enough to to continue, so that you're not sensitizing that stimulus for them. But that with repeated exposures after the first few times, what you should see if you started at the right level is that they should stop showing a panting or a breakthrough type reaction, and they should start looking at you when they hear that sound for the food that will come next. So, for example, with the gunshots, you could go from a recorded gunshot to an actual cap gun at a distance to, being far away from, an actual range. And some of you, this may matter not at all to. You may never want to have them be close enough to a gunshot for that to matter in their life. But it's just an example of some of the feared stimuli that relate to noise. Dishes might be part of it. Or dishes could be another fear of noise, clinking and clanking of pots and things like that. Fireworks can be difficult also to increase gradually that intensity. At least they don't come with a host of other cues like storms. So you can, start with a recorded sound, work on distance, from the fireworks. And we'll kind of talk about some safety issues related to summer and sounds in a few more minutes. So when we're talking about what should we do in between the times we're exposing them and trying to help them feel better, we want to teach them how to relax. And we do that without being in that moment. So no storm, no gunshot, no fireworks. We want to teach them how to sit or lay down and be relaxed, be still, be breathing deep, not be just ready to spring right up, coiled to get a treat. We want to teach them how it really feels to kind of slump and relax and get them to know that that's a daily rewarded behavior and that it feels good to do. We can then measure how they're doing. We can double check, how are they doing with this sound? If we ask them to do their relaxed sit or their relaxed down, and we ask them to stay, and we've been practicing that for reward, if we go through the counter conditioning process, pairing that food with the sound over and over again, 20 to 50 times, and they seem to be doing well, how can we test it? Well, this is how. We can ask them to sit and stay and then have the sound happen. If they get up, it's a lower level way of showing us that they're not as comfortable. And so we need to maybe do some more work. Practice is part of this. And again, I can hear you guys out there now going, oh my goodness, this is my life's work now is going to be devoted to sounds, management. And it is not a short process at times, but it is a process that works. However, even though we've talked about the behavior modification piece, teaching them how to feel differently, teaching them how it feels to get calm and get to that calm space, we can do a lot with environmental modification. So we're going to talk a little bit about how we can change their environment to make them feel better. We also can do things with, how are you managing them at home? Are there things that you could do and things that you could leave them on days when you feel like a storm is likely, or any storm at all has been predicted, or any clouds have been predicted, or that kind of thing. The behavioral therapy we talked about. We'll talk about medication a little bit at the end, simply because this is a challenging behavioral situation. Sometimes we use that in conjunction with, a behavior plan to help get them to a point where they can learn, get calm enough to learn. And that's always done through your veterinarian. So Typically, all these things need to be done together, not in sequence, like we tried this, and then we tried this, and then we tried this. We kind of need to do it all together to give them a little bit of a safety net so that they can start feeling better. So typically we create a safe room for them. We might use blackout drapes. Sometimes we just notice where they would go in a storm so that they, we're giving them the space that we're giving them access to a space they already feel like they need to be in and augmenting that space. Sometimes it's an interior closet that has no windows. It might be a bathroom that has no windows. It might be a basement corner. They choose typically where they try to get to. This is an example of a dog who broke a tooth getting out of a crate that was not in a safe space that dog felt okay in. Usually we'd like to have lots of bedding or carpet to help damp down noise and kind of refractory echoes. Having white noise in that room, so a fan or an allergy filter, something that makes a lot of white noise, to have noise to kind of damp down outside noises, and then some sort of calm music, TV or radio that they can focus on, so the brain has something to focus on. Dog appeasing pheromone is a synthetic pheromone that dogs make, so it's kind of a communication pheromone, a communication molecule. It takes dogs back to hopefully a good memory and a good association, which would be the smell of mom, basically. And that can be a plug-in in that room to kind of further accentuate the safety aspect of that room. And then, we can practice things with thunderstorm CDs. I've worked with dogs for whom that was a low-level stimulus and they were not even startled by it, and some that were so profoundly startled by the sound of a rolling thunder on, the kind of poorest recording or projecting equipment we had, they still couldn't, they still were having trouble at that level. So all of them are a bit different. Enrichment relieves stress, so developing daily good habits of enrichment and its availability, that will help them, eat more, eat kind of more consistently through that, part of the day. If they can stay calmer, if they can eat, they can stay calmer. It also gives them a purposeful behavior that relieves stress and can possibly relieve anxiety as well. We also want to avoid correcting the fear. So there's some myths out there about, that if you, show them kindness or you cuddle them or you pet them, that they will, they'll do that behavior more to get your attention. And I can assure you they're not in that part of their brain, their higher brain, that would use that as information of what behaviors to repeat. They're definitely in that emotional brain where if you can calm them down, then they can get access to that higher brain and do that kind of thinking. But what we're working with is wholly, a fearful behavior. So what we can do is we can help them if they seek attention from you. We can cue them to calm. We can counter condition them if there's active predictors in the area. We can redirect them to appropriate outlets, which are their enrichment toys. And we can, teach them how to show their relaxed behaviors in the presence of their fearful stimuli eventually. So even though there might be a loud noise, they can get calmer and calmer with this counter conditioning and then the gradual transition to asking them to show a physical calm behavior. So some of you may have pets that are trying actively to escape where they are, or they have injured themselves trying to get away from sounds or get to a safe place. We just, as logical, not scared humans, can hardly imagine what they might do either to get to their safe place or get away from something that has scared them. And it can be really profound. And again, with that state of mind, when they are in that, when they're very, very afraid and they're over threshold, they're not feeling pain, and pain is not informing their decisions. So if they break a tooth, if they lacerate themselves, they aren't going to feel that pain until much, much later, because that's another survival part of, that system. It helps keep them safe while they're trying to escape. Otherwise, they would not try to escape because it might be uncomfortable or painful. So we can't consider whether, they're thinking it through. They're not at that point. But this would be definitely a criteria to bring up to your vet So I mentioned medications before, and this is, working as a team with your veterinarian. That's what I do a lot in cases like these, because if a pet is too stressed and too anxious, they can't learn. They actually can't make a long-term memory from a working memory session if they are at such a high level of reaction. And so what we may need to do to help them get to a point where they're more comfortable, less anxious, and more able to learn is, to consult with your veterinarian, get a whole picture of everything that, we need to, and consider how can we relieve that panic, and how can we decrease their anxiety so that they can get to a point where this behavior modification type plan can help them. There are medications that can help short-term relief of panic symptoms. So there are things that you could give them and might be effective the same day. Typically, the treatment, with veterinarians and behavior meds tends to be trying to, alleviate panic for as long as that's necessary, while they help with a longer acting, less side effect laden, medication that might help them feel less anxious down the line for several months, from now. So when to consider it with self-injury, with dangerous escape attempts, if you feel like you have no place to start. So you have that dog who the smallest volume of the thunderstorm CD is still too much to start from, then that might mean not that all is lost, because it isn't. It just means that animal might need some additional help to be able to make use of the learning. The goal is happy, healthy pets that can live in their own skin and feel comfortable in their environment. And storms and 4th of July noises and loud noises sometimes invade our environments without us wanting them to, and we can't avoid them. And so when it's an unavoidable, scary thing, we need to help the pet learn how to manage it and how to feel differently so that they can enjoy their life, and so can you. So with that, see if I can successfully transition back here. Okay.
All right. Well, thank you very much, Dr. Willis. We certainly appreciate that. That was very eye-opening and very informing. It was awesome even for me to sit here and listen to. I love that. So it seems like some of the questions that were coming in, we actually went ahead and already kind of answered in your presentation. Things like, are there breeds that are specific to having this kind of tendency to be scared of storms? Things that are related to, senior dogs, older dogs, developing a fear that they didn't used to have. At what point should we start considering medication, and some of the short-term effects? One of the things that's been coming in is in terms of like a short-term option, sort of a Band-Aid situation. If individuals don't necessarily have an issue with storms per se, but on big, high stimulus days like 4th of July, they consistently are having problems with their dog getting past threshold and showing some potentially damaging signs of fear and anxiety. How would they go about mediating that problem?
That's a great question. And I think it's good if you know that your pet has that problem to do a few things in preparation for 4th of July. First of all, as much as it is one holiday, we do see noises that come from fireworks all the few weeks preceding and several weeks afterwards. And so it can feel a lot like those pets are kind of unable to escape that as well. So, working with your veterinarian to work on a medication option can be very helpful, since sometimes those are acute and very loud intensity situations. So, the right medication, at the right dose can take some time to figure out. And so that means that, coming, early in July and asking for help may mean that it might not be the right choice or the right dose. We might have to find, working with your vet, figuring out what the right choice is ahead of time, and figuring out other fears that pet may have that we could measure that with and test that with. so that we are prepared going into kind of the month before and sometimes the few weeks after that happening. So I would still say, don't wait till the last minute. And if your dog has ever shown any sort of, reactions to noise that were even slight startles, don't take them into a crowded area on 4th of July and be right there with the noise and all of the other unpredictable things that might happen. Many dogs are lost on 4th of July, either from breaking away from their owners on their leash in panic, or jumping the fence, maybe something they've never done before. So if you think that your dog is maybe having a challenge with that, create a safe room for them. Don't leave them outside, kind of for this duration of summer, because it could happen anytime. And your neighborhood's best. So if there are certain, chances of that or not. But just erring always on the side of management and safety, making sure that pet, doesn't get lost. Pets running in panic at large don't come to people that they might otherwise come to. And it can end sadly.
Excellent. Thank you very much. So one of the other questions we have is pertaining to dogs having a different response to storms and to loud noises, but maybe isn't necessarily related to the dog necessarily being a senior. So this one says, my dog is 2 years old and is afraid of thunder, but the thing is, he wasn't afraid of them last year. Why is he all of a sudden scared? And is there something we could have done to prevent this?
That's a great question. And I think that whenever your dog or cat shows a new behavior that's challenging and scary and affecting their welfare, you always kind of think, is there something I could have done differently that might have better prepared them? First, I wanted to just say, for dogs, when they arrive at social maturity, which is kind of that 1.5 to 3 years of age, they may be processing that situation differently than they were as a puppy. And so puppies tend to be taking in information, and then as they arrive at social maturity, their brains consolidate and they have possibly more assertive or more profound reactions to them. So it's not unusual for the puppies to be fine, apparently fine, and then the adults to show pretty profound things. And so that's kind of a maybe more typical way for it to present, especially since it happens from year to year and there's such a long time with none of that stimulus occurring. Things to do to prevent it. It's unclear whether it's wholly preventable. So there hasn't been a controlled study that has looked at, we will expose these puppies to loud noises at 14 weeks and do all of these things the same, and then these puppies will not be exposed, and we'll see how it turns out. We don't do that. We haven't done that study, so we can't wholly say it's preventable. However, if you have a puppy or a young dog or a dog that just doesn't show these behaviors yet, you can do what I'm suggesting, which is make thunder into a predictor of fun, or clouds into a predictor of its playtime. You can teach that dog an association that's positive with those stimuli. Like, hey, mom gets really fun every time there's a flash of lightning. So yay, there's a flash of lightning. What's going to happen now? And so you can teach an association where there isn't a fear. And so the thinking is that would be the best you could do to prevent, and that may possibly, with very good science behind it, be helpful in preventing that.
Well, that makes a lot of sense, and the power of the association certainly makes a lot of sense and is really interesting. And that's such an accessible, awesome tool. And you gave it. If anyone's missed that portion of the presentation that Dr. Willis gave, I definitely suggest checking that section out, because she gives some really interesting insight as to how you can do this and what kinds of things you can pair in those situations to make it less stressful for the animal. Next question I got for you. I have a toddler at home and she loves Dobby, our dog. Dobby is scared of thunder, and I'm nervous he might bite our toddler if she tries to play with him during the storm. Do you have any suggestions?
Yeah, hi. So it's wonderful that your dog and your toddler enjoy playing together, because that's one of the most rewarding relationships that children can have is with their dog. It is worth noting that sometimes you can have sort of the cumulative trigger or trigger stacking occur, where if if playing with your child is sort of stressful and there's a storm, it's possible if he's ever shown aggression in the past, when he's been tired or hurt towards your toddler, that could kind of come out in sort of a breakthrough event. However, I wouldn't necessarily say that because they're fearful of storms that they would necessarily be aggressive. It's always possible whenever an animal is extremely afraid that could, kind of redirect at sort of the straw that broke the camel's back. However, I think that if you and your family show, that you are sort of helpful in calming him down and being a port in the storm, literally, to help him feel better, that you guys are calming to him, that would be less likely. If he were able to play during a storm, it might help him stay calmer if he enjoys that interaction, if he enjoys, that time with your toddler. And since you didn't give too many other details, I'm going to assume that probably prior to this, there's been no issue with aggression, with Dobby and your child. So that would be one that I would watch and start to notice signs that might be telling you that he's getting nervous. They look a lot the same in low-level signs of stress. So dilated pupils, panting, looking around, pacing, getting very stiff or still, not showing social behavior. You will very easily see, I think, whether or not that's a calming interaction for your dog, hopefully at a lower level, so you can make sure that you're not, kind of making a straw that broke the camel's back sort of situation. And again, having food involved where you toss food to him or you're giving him food and you're helping him get calm. Maybe if he's calm enough, he can play and that will help keep him calm. So it's really, I don't know if I have enough information to say, but it's certainly possible that, for a dog who tolerates playing with a toddler but isn't wholly comfortable with it, that it could end with some more assertiveness. However, it's not necessarily true that would happen.
Great. So our next question is, our dog Pooter had one issue with a big garbage bag being opened. This is the only sound issue he came to us with. Over time, he has developed noise sensitivity. He can sense a thunderstorm before we can even hear it. He becomes paralyzed and then he has a panic attack. We've tried diversion with tricks and treats. What can we do?
Well, I think you've hit on something important, which is certainly how one sound sensitivity can certainly, cause others to be more apparent and cause others to be more acute over time. So sort of that generalizing, just concern about noise. Also important is your thoughts on getting to it before it gets to that panic zone. It sounds like he may be among the more sensitive. However, there's a lot we can do. So certainly he may be reacting well in advance of thunder because he's sensing that static electricity, that, ozone smell, the barometric pressure dropping. So there may be things that he's cueing off of that, are putting him to that over threshold point well before the thunder. And so that's harder as far as counter conditioning to work on. There are some tools that have some variable success. There's a storm defender jacket that many people feel helps a lot with the static electricity aspect of it. There's also a thunder shirt that it has some mixed reviews, but it kind of works on an overshadowing of the stimulus. So sort of like when you have a hurt elbow, you rub it really hard and you kind of overshadow the pain message that's there. And so they work on that kind of a principle, but not every dog responds to those. It really sounds like he might be one to talk with your veterinarian to get him to a point where some of these things might be able to help him. Also thinking about enrichment again. How can we give him tools to self-soothe and cope on days well before he gets to that stimulus? And what you're talking about with him being paralyzed, certainly is, that freeze response of fear. And thinking about in that moment, if that happens and you're home, sitting down with him, right there with him, trying to pet him, talk to him, get him to eat something, putting food even in his mouth. So he's got to start the salivation process. That can kind of help him calm down a little bit. And then just getting him to focus on you. When they get really, really scared, their world gets really small, as far as like what your voice means, what your, you're standing above him or you're standing across the room talking to him. He may not be processing that, but if you're right in front of him and he's got to put, that visual input somewhere, that can really help. And so it's not it's not how you want to treat it forever. It can help that moment, but I think you may be in need of some other adjuncts to, just behavior modification, because it will be helpful if you start paying attention to any, changes in this guy, start keeping him calm early on. But that's exhausting to do every day, with us having the storms and the cloud cover that we've had, even just in the last week. That would be almost every day, much of the day. And so that's where, when we get to a point where we're trying to help him feel better most of his day, that's where, talking to your vet about some help. And let me just say, as far as medication goes, this is not a sedative that's going to leave them drooling in a corner. That's not the goal of any sort of, medication help that your veterinarian would supply. So it's not meant to be just sedating to them. It's meant to alleviate that panic, alleviate that anxiety, make them honestly feel better. And then, because of that different climate in their brain, then they can start making use of some of those things that you can then do.
Very cool. Okay. And this next question actually ties in very nicely to what we were actually just talking about. So this viewer asks, whenever my dog is scared, I just try to hold her tight and pet her. Does this actually work, or am I making it worse?
Great question. I'm so glad someone asked that, because I think that's just kind of a perpetual myth out there, that if you show them that you're kind and calming and reassuring them, that somehow they're going to choose to offer you this fearful behavior to get attention. And really, nothing could be really further from the truth. If something terrible happened to you and a friend came and gave you a hug and tried to comfort you, you wouldn't necessarily be more afraid of that scary thing that happened, or show more fear. And so we need to kind of meet them where they are. They're really cognitively much more like young human children, prior to that sort of manipulative or deceptive phase that, that humans can get into. They're very much true to what they're feeling. And so if we are trying to help them feel better and we're, talking to them, soothing them, it may not be a treatment plan, but it's not necessarily a bad thing to do. And sometimes dogs can be more soothed, pets can be more soothed by touch than by food. Not often, I'll just say that. So the food part is a chemical kind of confusion that we can give them. If we can get them to eat in that moment, then they're starting that digestion, they're changing kind of the which way is the tug of war going, as far as which part of the brain is going to win out at that moment. And so if we can get them eating, we're actually kind of helping them get calmer just because they are, just because they're eating, we're kind of reversing the blood to where it needs to do digestion instead. And so that can actually help. But no, you're not going to make it worse.
Excellent. Okay. So the next question I've got for you is, I have had my dog for 7 years, and she is an Australian Shepherd who still has a problem with booming sounds. We usually put on the radio to drown out the sounds, but it isn't working so much. I can't stay with her the whole time since I go to CSU during the fall and spring semesters. My parents live in California and are trying to get they're trying their best to get her, but can't help her. We got her a thunder shirt and lavender spray today, but I'm not sure if it will work. Do you have any tips for me?
Sure. So going back to kind of what we talked about a little bit, I think it's important to try not just one thing at a time in series, but to do them all together. So Lavender itself has not really had anything associated with it that alleviates anxiety specifically. It's best usually in combination with dog appeasing pheromone. The thunder shirts, again, have some variable success. Some independent research on it has shown some benefit. Others have not. You know, I've not observed the 80% success rate that they claim. However, you know, it works on the principle of overshadowing, you know, trying to give other alternate input aside just from the sensory input of hearing. But again, thinking about environmental management, you know, creating a safe room that is maybe more specific than letting her have the run of the house where she might be exposed to windows and sounds more easily. You know, adding in enrichment, working on, you know, when you have her and your home, working on, you know, desensitizing what cues you can, you know, related to sound. So starting to teach her that different, you know, anticipation. Again, when we can't manage the environment wholly, and certainly you have a life and we have lives, you know, we have lives we can't put on hold. Sometimes we can choose activities for them to do while we have, you know, different things come on board. So if, for example, you talk to your vet about medication and, you know, many of the medications may take 3 or 4 weeks to become effective, which is why, you know, if we have, you know, noise sensitive, you know, dogs, we try and work with their veterinarians to start that medication, you know, early in the spring before thunderstorms start. So they're at that effective therapeutic dose. Now, here we are, we're almost to June. Are we at June? Nope, almost tomorrow. So we, you know, we may have already been into that season for a while. So you might need to think about, you know, putting her in doggy daycare for a couple weeks while the medication gets, you know, to a level that she can be more comfortable. But it is hard to mesh real life with what their best needs are. And so we want to make sure that, you know, when we try and treat them, we're helping them. We're also not making it impossible for you. Noise phobia is a tough one. Because of that sort of biological preparation and because it's really hard to block out real life full intensity stimuli. And so that's where sometimes we need a little help through managing the environment and sometimes, you know, with your veterinarian and medication.
Excellent. Okay, and we actually just got a really interesting new question in, so I'll throw this one to you. So we got a student here, vet student, asking about a new oral mucosal gel medication called Sileo. It's marketed specifically for noise anxiety, and it looks like a dexmedetomidine in a mucosal gel form. And she's wondering about whether or not this would be a possible option for her 3-year-old golden retriever that's extremely sensitive to noises, and they haven't had excellent luck with other treatment options that they've tried that have included alprazolam, ACE, thunder shirts, pheromone diffusers, etc. So some of the things we've been talking about, seems like they haven't had excellent luck with that just yet. And they're wondering if you have any insight about this Sileo medication, perhaps.
Yeah, so it's a new FDA approved medication for noise phobia. And I really usually don't give specific medication information as far as a recommendation because there's so many factors that play into that. So that's something, again, that in, you know, consultation with their veterinarian, it certainly is a useful, you know, potential medication. It tends to be very much less sedating than some things like alprazolam. And it's like some other medications that do treat more longer acting, you know, or longer acting anti-anxiety medications. However, there's a lot of factors that go into choosing a medication for their pet. And so especially with sensitivities, it would be something that would just be, and it would be in the group of options. But just simply the fact that it's gone through FDA approval means that they were able to demonstrate an effect with the affected population.
Excellent. Okay. So the next one I've got here for you, I have a dog who has had several surgeries in the past 2 years. Needless to say, she has become fearful of people and I can no longer take her in public. Sorry, this is not noise related. She barks and raises hackles when people walk directly toward her. She's now becoming fearful of children and is generalizing to noises. What might this individual owner?
Well, thank you for that question, because I think it is important to realize that behaviors don't occur in a vacuum. And while we talk about noise phobia, today it's really a model for many other fears that we could treat similarly, and possibly more easily, since we can control more about what people might do than what storms might do, for example, in as far as practice. First, let me say that this may be another situation. I think you mentioned she was 2 or 3 years old, where she may have had kind of a set of painful experiences growing up that associated, people with invasive procedures or recovery or taking stitches out. And that's certainly how a lot of fear of the vet type things can happen. And then also, fear of strangers. And so it's not necessarily that it was all related to that. However, you can treat it where you try and, again, look at what is the lowest intensity that we could present, this dog, so that we could start counter conditioning. So where could she be? Could she be at any distance from a person and not be over threshold and reacting? So if there's, a few hundred feet away, if there's a person, if she's already over threshold, then she may be kind of in that category that a different set of medications for anxiety might be helpful for her with her veterinarian. However, with the number of things that she's concerned about, number of things she's showing that she's threatened by, we do need to kind of treat that as she's afraid of those things. So remember, aggression or offensive threat displays are a sign of fear too. So we can teach her how to associate better things with people approaching her. It would start with people just appearing and not even noticing her. That would probably be the lowest intensity to practice. And sometimes you can work with them, several hundred feet away from a trail where people appear and walk at a, perpendicular way from you, and start kind of teaching her to anticipate positive things when a person just appears. There's a whole lot of things that we talked about maybe last time too that might be helpful. I think we probably have that link, and we can make that available too for when we talked about aggression and some tools with that. But essentially it's the same idea. And so it's embracing this idea that if they see a person, even if they growl, even if they bark, you feed them, because you're feeding them in association with what they're afraid of. You're teaching them a new expectation of what that person means to them. It means that the barking and the growling disappear and go away, not that we'll see them more often. So again, that's usually like the biggest twist that's hard to understand about how to approach aggression. But if you approach it that way, she'll feel better sooner. You'll feel better helping her. The whole service dog angle is a little bit harder because she has such a higher set of criteria she has to meet. But I would encourage you, to work with a professional in your area to try to help her start with those emotional, improvements, and then, go back to seeing if she could then do service dog work as well.
Great. And just a couple questions here for you to wrap things up. So how would you help a dog that is not necessarily bothered so much by sounds, but by other factors such as barometric pressure changes or static electricity?
Great question, because I think that is a lot of the affected dogs that have this problem with storm phobia. I think, there are ways to help your environment be a little bit different as far as the static electricity. The Storm Defender coat has had many, veterinarians highly recommend it. I have not had as much success with that, although there are kind of enough interesting pieces of information just in general about different anecdotal reports, owners doing different things to alleviate static electricity, that could definitely be part of it. Again, those things that we can't control and we can't do behavior modification for, like, I don't know when the barometric pressure actually drops. That's a hard moment for me to figure out. So I can't modify that as easily. that's where we're looking again at augmenting their environment in other ways, either through safe zones, creating areas that they feel safe, helping them, in conjunction with their veterinarian, look at alleviating that anxiety and that panic to hopefully where we can give them better tools to cope with their stress.
Excellent. And then finally, we have a question here that's pretty relevant, and I think ties into really great to a lot of what other people have been asking. So this owner is wondering if their dog might just outgrow their fear of noises and of storms on their own. If just given time and not really any actions taken, won't they just kind of get used to it and outgrow that fear on their own?
Again, another great question that I think gets right to the heart of another kind of myth that exists, which is, if we ignore their fear and don't give them any reaction or any response to it, that eventually they'll figure out it just doesn't work for them. Unfortunately, that doesn't happen, and we see the opposite phenomenon often happen of sensitizing that fear, generalizing it to other things. Several owners even here have mentioned, it started with one thing and it kind of moved to other things. And so it definitely won't necessarily improve without new information or without, behavior modification to teach them a new association with that. So it's important that if you're going to work with your pet on this, start as soon as they start showing they're nervous. Create a safe environment for them. Start trying when you can be with them to practice new associations. Give them tools that they can help themselves feel better with. And so, that the outgrowing it idea is just something that could backfire. And so as dogs age, the part of their brain that kind of regulates fear responses can get less and less good at that. And so it can be that they worsen through their life. And so often, like one of the people who had their question about older dogs having new fears, that can definitely happen. So if they go through their life kind of chronically afraid, they can have sort of a profound, change too, again, in those older years as they change how they're processing things.
Excellent. Well, thank you again so much. This has been really informative and awesome, and I love being a part of this. It's so cool. So just for the viewers out there, if there have been any additional questions that kind of came in on the tail end of this thing, if we didn't get to them, we'll go ahead and make sure that we respond to those via email. And just so you know, if you'd like to watch this hangout again, or if you missed the beginning, you can find this on the Colorado State University Veterinary Teaching Hospital webpage or on the Colorado State University YouTube channel. So with that, thank you very much for your time and for watching. Thank you, Dr. Willis, for all the insight, and have a great evening.